Hello. So, someone asked me, and also I've been wanting to do this for a while, to make a video explaining my experience that I've had working as a medical scribe. I've been working as a medical scribe in an emergency department in San Antonio for about a little less than a year now, and I've definitely learned a lot along the way, and my life has changed significantly because of this job. So hopefully if you had any questions about what it's like to be a medical scribe, especially in an emergency department, this will answer some of those questions for you. So first of all, you're probably wondering, if you've never heard of this job before, you're probably like, what do I even do? So the premise of a medical scribe is to assist the physician in the documentation process. Healthcare is very centered around documentation, at least modern healthcare. It's really important to have everything that was spoken to the patient about, everything the patient said, all the medications the patient took, pretty much everything about that patient in their hospital stay. It's really important for that to be documented in some sort of chart because of insurance. And what my understanding is, depending on what is put in the patient's electronic medical chart, the hospital will get X amount of money based on what the insurance will and will not cover based on those keywords that are kind of in the chart. There's also some really obvious reasons why it's important to have an electronic medical record, such as continuity of care, so that if I go to a clinic that is within a certain health system and then I go to an emergency room for different complaints, people in that healthcare system can look up my records and easily access my past history. And this becomes really important when you're dealing with patients who come in by the ambulance, or patients who come in and they're unconscious or unable to give you their history. So that is why documentation is so important in health. So now, why does a physician or a healthcare provider need a scribe? So to my knowledge, medical scribes are mostly used in acute care or emergency care settings where there's a high load of patients, and people are coming in through the waiting room and they gotta get treated, and this is kind of like a very fast-paced sort of thing. Charting or writing a patient's chart can take up a lot of time. There are days when I have 8-hour shifts where I don't get to catch a break. I maybe go to the bathroom twice. I maybe get to eat lunch. So it's very busy. And it takes me 8 hours to complete, charts for X amount of patients. Now just think that, this physician has been out the hospital all day, treating patients, doing procedures, ordering labs, reading imaging, and they have to go home without us and complete the same amount of documentation or even more that I would have done if I was working with them. And so you can see how easily, without a medical scribe, especially in emergency medicine, an 8-hour workday can easily turn into a 16-hour workday. Or alternatively, the provider could do his or her charts, patient by patient. And, after every patient complete a chart, sit down, get it all written out, finish it, so they don't have to go home and finish it. But, something with that is that's going to slow down the amount of patients you can see in one day. Again, important in emergency medicine, and especially important at the hospital where I work at. We have such a high volume load of patients that, if our providers stop to work on their notes after seeing every patient, then our waiting room would get even more filled up, and that would just not be good for anybody. So here's what I actually do. I assist the provider that I'm working with by accompanying them to their visit into a patient's room. And in that room, I either bring my handy dandy clipboard with some paper on it, or we have this thing called a computer on wheels. It used to be called, it is a workstation on wheels. It used to be called a computer on wheels, but what I've heard is that people were referring to it as the cow, and a patient got offended. When I'm in the room with the provider, I am taking notes on the whole interview that the provider is having with the patient. And you can imagine what that's like in an emergency room. Like, so what are you here for today? Like, where does it hurt? And it's that sort of thing. And it generally moves from more generalized questions like, what's your main complaint? Where is it localized in the body? To like very specific things like, what other symptoms have you been having along with this? Or like, have you noticed anything in the past few days? Or have you had anything like this before? It also includes a lot discussing the patient's, past medical history, and that's really important when you're treating someone, because if they have diabetes, they might, react to a treatment differently, or than if they didn't have diabetes, or if they have cancer, then that's gonna complicate things, and you might have to get, oncology involved. And also family history, that is also important when evaluating cardiac patients. You want to know, like, does this person have a risk of having a heart attack in an early age because his dad did, or does he have a history of hypertension, so should we be concerned about possible blood clots here? So basically I'm just listening into this entire conversation, and I'm taking notes on my clipboard or on my cow. And generally the way I do it is I have like a Word document open or like Notepad, and I'm just scribbling, because this goes really fast, guys. You don't know how fast it goes. And when I first started, I was like, I don't know how to keep up, help. And then I'll go back to my workstation or whatever with my provider, and I'll sit down and I will do the hard part, or my entire job, which is to transform all of these notes, basically this entire conversation that the provider had with the patient, into, from layman's terms into medical terminology. And this is where medical terminology knowledge gets really important. So you need to know words like, if the patient's like, I'm having trouble breathing, you need to say that patient's dyspneic, or they're breathing fast, like tachypnic, or they've been complaining of, they've passed out, or they syncopized. Because these charts are going to be read by other medical professionals, so it's important for them to be, very specific in terms of how you word things. I would say this part is the hardest because it's transforming just like line after line of conversation into a very, well put together paragraph that correctly explains why this patient's here and, anything relevant in their history in a very, nice order. That's definitely something that I struggled with, and it took me quite a while to learn how to write very good paragraphs. And these, by the way, are called History of Present Illness. We call it the HPI. And that's basically the majority of our job, is writing the HPI for each single patient. And it can take a while, like I said. I can spend my entire 8 hours doing practically nothing but writing HPIs. Other things that we do as scribes in the patient's electronic medical record are document the provider's physical exam findings, and often the providers will have some sort of like a thing that you put in the chart, and it expands. It's like a drop down list of default, like a normal physical exam, and they will tell us, you need to go in and edit this, change this to this, blah blah blah, if something is abnormal when they examine the patient. We also document the physician or provider's medical decision making in that same chart, and that's basically, what are they going to order on this patient? What labs do we need to look at to rule out this, or this? Or what imaging studies do we need? And, are we going to get fluids, or like, what are we going to do with this guy? So that's medical decision making. We also document EKG interpretations, which is really important for insurance purposes. Sorry, I forgot the word. It's really important for insurance purposes, so we will go find an EKG on that patient and ask the provider, hey, can you interpret this for me? And then we'll input, everything there is to be said about the EKG and whether it's, normal, abnormal, concerning, for whatever. We also sometimes do consults, which means we place in the chart that we document in the chart that we want to consult this specific service for this person, maybe for admission. So, for example, if someone's coming in and they have a stroke, obviously they're probably going to be admitted to like neurology or neurosurgery or neuro ICU. So we put those in the charts. And something I can also do is page these actual consulting services, so I can go on the page website and put in the physician's phone number and have them call them to consult on this patient. So that is the gist of what my job is. There's little things that you can do as a scribe that kind of make you stand out. One of them being, thoroughly reviewing that patient's past medical history. We have a lot of patients who come through our ER who've been, worked up in clinics before, they've been admitted before, so they have, like, a vast number of medical records that are in our system that I can access. And so I go through there prior to seeing every patient, and, I pick up things that are pertinent, like, did this person have a surgery for this, or is it something, did they have a history of something that's related to their current complaint? So another thing you can do as a scribe to make you stand out, and something that's just really generally important for multiple reasons, is be a really good listener. And I can give you one one example where this was very important. So one time I was seeing a patient with a provider, and he had some abdominal pain, sort of like right below his breast, whatever, the male, what's the male breast? Right here, basically. That was a really awkward position. And, that's not very concerning for multiple reasons. And he had all these other symptoms, and it was mostly central around his abdomen, but, in his back, but there's nothing in his chest. And so I asked my provider for his, medical decision making, like, so what are we going to do? What labs are we going to order? So I can put it in the chart, right? And I noticed he didn't, put in anything about any cardiac labs, such as ordering troponin or ordering, a CT chest or whatever. And this stood out to me because I noticed one very small thing that this patient had said, which was, I have some left shoulder pain. And if you know anything about, cardiac events, left arm pain, left shoulder pain, left-sided chest pain is very indicative of something that would indicate a cardiac event. So I mentioned this to my physician, and I said, so are you going to order any labs on his heart? Because he complained about this one thing, and my provider legit said to me, oh no, that changes my entire workup. And of course, I don't think this patient had any sort of major cardiac event, but the important thing is that, I caught that, and he did it. And a lot of doctors are, their heads are all over the place during their shift. They have so many patients to, worry about that, a small detail like that can slip their mind. So sometimes you just being there, like an extra person listening to the patient, can really, change what the provider is doing if you catch something that they don't. So finally, I'm sorry this video is super long, by the way. But now I want to talk about, what do you need to become a medical scribe? If this is something you're interested in because you're pre-health or you're just interested in, getting into the hospital. So, first of all, there's no certification that you need to legally be able to work as a medical scribe. I'm not certified in anything. You don't have to be. You don't even have to go through a company like I did. I know there are some doctor's offices, not ERs, but, private practice that, hire medical scribes, on their own, and they don't necessarily hire through a company. I was hired by a specific company, which I'm not going to name because I want to keep my job, that, employs me via this hospital that I work at. And so I saw this company advertised at school on a bulletin board, in the science building, and, I gave them a call, and I went through an interview process with them, and they took all of their hires through a training process. And like I said, there's no certification, but the training process that I went through was to ensure that I had a good knowledge base of medical terminology and also HIPAA rules, which is important for, patient safety, patient security, before I got on the actual job site. So medical terminology you need to know, and I only did this training program for about 4 days, and I would say I learned about 200 words of med term. But my knowledge base of my term has grown significantly since I've started working. So there's no like single point at which you're ever going to be like ready enough for this job. You'll consistently learn new terms every single day if you end up working as a medical scribe. But you do need to have like a generalized base of like common complaints in medical terminology as soon as you go into the job. The second thing that is really important, especially if you have an electronic medical record system at your site, is typing skills. I type about 90 words per minute, and my providers are okay with that. I've had someone tell me that I type faster than they think. It's a compliment. But especially in an ER, the pace is very, very fast, and sometimes you won't have time to finish like a note before you see the next patient. So the faster your typing skills and the more accurate your typing skills are, the easier it will be on you. And probably the more satisfied the provider will be with you too, because you'll get your charts done faster. So if you decide to become a medical scribe not through a company like I did, I would recommend taking a medical terminology course on your own and make sure your typing skills are on point. So now I'm going to talk about pros and cons of why you should maybe choose this job or why not. So like I said, if you're pre-med, pre-nursing, pre-PA, pre-dentistry, maybe not pre-dentistry, but if you're pre-health in general, it's really good to get experience in a hospital setting or a clinic setting prior to applying to your professional school or prior to going to your professional school. And there's multiple reasons why. Probably number one, I would say, is that it shows that you have a really significant interest in this field, and that's going to look good on your application. Secondly, you need exposure to see if this is actually the job you want. And I have a story about this. So when I first started college, I was pre-med because I love science, and I thought, I want to be a doctor when I grow up because I've had such great experiences with my doctors in my life. And I started taking the classes. I took like about a year and a half of pre-med prerequisites, and I started scribing, and I have a really cool experience. I'm lucky at my hospital because it's a teaching hospital, and we're directly attached to a medical school. And so I not only work with actual doctors who've graduated residency, but I also work with residents and medical students who do their emergency medicine rotations at my hospital. And because of this, I have gotten to see a whole different perspective on, what it takes to become a doctor, what it's like being a medical student, what it's like being a resident. And also, something cool is I don't just work with doctors, I get to witness the interaction between doctors, PAs, nurses, techs, OTs, RTs. I get to witness, all these different staff interactions, which is really cool. And so I came into this job, pre-med, all the way. I'm going to become a doctor. And, as time went by at my job, I realized something kind of scary to me, which was that I was looking at the nurses doing their job like, I would rather be doing that. And I just learned a lot of things about what it's like to be a doctor that, I didn't know before, such as a doctor spends a great chunk of time sitting at a computer reading and interpreting labs and imaging, and not a ton of time spent with the patient. And that was one of the main selling points for me as for why I changed to pre-nursing. If you're pre-med, that's great, we need doctors, but I just learned more about, what type of job my personality would fit because I have this job, if that makes sense. Another huge perk of becoming a medical scribe is the connections that you will build with the providers that you work with and the possible references that you have. I already have one provider who's very high up in our emergency department who's agreed to write me a letter of recommendation, and I know many people who've gotten into medical school using references from providers that they work with on a daily basis. If you stay at this job long enough, you'll end up working with the same providers over and over and over. They get to know you on a personal level sometimes, and you can build this really great professional relationship that can help you in the long run. And finally, last but not least, you'll go home with some pretty cool and or gross stories to tell people about. my job is hard sometimes, but the stories that I take away from it, I'm not gonna tell any because, again, I want to keep my job. The stories that I take away from my job take the cake. Let me just say that. If you worked in a hospital, you know you have some crazy hospital stories. That's basically all the information I have about being a medical scribe. And I'm sorry that this video is very long, but I hoped that it answered any possible questions you might have. If you have any more questions, leave a comment below. I feel so weird saying that. Thank you very much for watching if you made it to the end of this video, and I will see you in the next one.